Our next speaker is Alison Taba, and she's a physical therapist with Diablo Valley Oncology, and is going to talk about oncology rehab. Yes. Thank you. Good evening. Tonight I wanted to touch on cancer-related fatigue, like what it is and what you can do to help decrease the fatigue level. So I thought before I start, we'd all stand up. Since we've been sitting for a while, we get up, move around a little bit, get started with your fatigue, decreasing your fatigue. And if you feel comfortable standing, that's fine. We can do these things sitting down too. So we're just going to go through just a little bit of movement just to kind of get the blood flowing a little bit. So we're just going to start with some shoulder rolls, right? Big shoulder rolls, up and down, squeezing them together. Shrug it all the way up to your ears, roll it back. Okay, now we're going to do just big arm movements, so just careful, make sure you have space. Don't hit your neighbor unless you want to. So as you do this, really extend, arch your back. Good, breathe in, exhale. Breathe in. Alright, good. So now you're going to do big circles with your arms up. Squeeze it back. Good. Big circles, open up your chest. Breathe, inhale, exhale. Good. One more time. Up and out. Alright, and if you feel comfortable, spread your legs apart. You're going to use your chair as your guide. Hands on your hips. Touch your bottom to your chair, and then come up. Touch your bottom to the chair. Yeah. Come up. Good. One more time. Down and up. Alright, good. And everybody have a seat. Hopefully you're kind of up a little bit now. Okay, so going back to cancer-related fatigue, the National Comprehensive Cancer Network. Oh, so if my voice tends to be a little soft, so if you don't hear me, just kind of wave at me. Okay. The National Comprehensive Cancer Network has given a definition as to what cancer-related fatigue is. But basically, it's just an overwhelming feeling of exhaustion. You're feeling tired all the time. You're having a hard time concentrating, difficulty focusing on tasks. Basically, you're just tired all the time. And this can arise at any point during your treatment, as you're going through chemotherapy, maybe after your surgery. Sometimes it does last months to even years after you're done with your treatments. And this differs from just what you consider normal fatigue or just feeling tired, is that, if you feel like you've had a good night's rest, you've taken a nap, but you still wake up and you're feeling fatigued, you're feeling tired. There are many causes to cancer-related fatigue, factors such as pain, side effects from medications that you're taking. If you're having your appetite isn't what it used to be, you're not taking in the adequate nutrients, you're not sleeping well, and if you're overall just having a diminished or lack of activity. Even the cancer treatments that you're going through can contribute to the fatigue. Depending on what regimen that you're on, the chemicals going through your body can cause muscle atrophy, leading to muscle weakness. It can also affect your oxygen intake, so the oxygen delivery throughout your body, the oxygen delivery to your muscles too, also relating to some of the muscle weakness that might happen. And also prolonged bed rest can also attribute to a decrease in muscle strength and also your cardiorespiratory function. So now what can you do to help combat some of this fatigue? So this is just a list of some tips for energy conservation. They seem pretty basic, but sometimes it's just reminders of what to do to kind of conserve your energy helps. So setting priorities throughout the day, and as you're going through your activities, trying to pace yourself through those activities at those times when you feel most energetic. Sometimes, my patients will feel a little bit better in the morning, so then they'll schedule a task in the morning, schedule an appointment in the morning, or after your afternoon nap, you're feeling a little bit better, so then schedule your appointments or activities in the afternoon. And then try to engage in one activity at a time, so spread it out during the week. So say, today you're going to do your grocery shopping, tomorrow you're going to water the plants, but try to maybe just do one activity every day. And try to also limit your naps to less than an hour, so that'll enable you to get a better night's rest. But if you do feel you need to take a nap, take a nap. I mean, your body still needs to conserve that energy because you're still fighting off, whatever cancer treatments that you're going through. So what else can you do to help combat the fatigue? So exercise has been shown to be very beneficial. It's beneficial as you're going through your treatment and also when you're done with the treatment too. There are many benefits to exercise. Exercise helps to increase your endurance, so helping to increase the oxygen flow through your body, getting those oxygen molecules to your muscles. Strength training, resistance exercises has also been shown to help, increasing muscle mass, increasing your protein synthesis. Exercise also, like I was saying, helps to increase the oxygenation through your blood, getting more of those oxygen molecules to your muscles. And there's also secondary gains to exercise. As you start to feel a little bit better, as you start to gain a little bit more energy, then you're going to feel like you have a little bit more control as to your situation, gaining a little bit more of independence and able to do things without having to ask for help as much. So in relation to colon cancer, there has been postulated protective mechanisms from exercise. So exercise can increase the colon transit time. So meaning that, and this also goes along with a low-fat, high-fiber diet, making sure that you're intaking your water. This can decrease the amount of time that any kind of carcinogenic materials are in your colon, so less exposure to the colon. It has also been shown to increase an insulin-like growth factor binding protein. So this insulin-like growth factor can contribute to the progression of the tumor, so increasing the growth of the tumor. Exercise can also decrease the production of pro-inflammatory markers, so things such as prostaglandins, interleukin-6, which has also been shown to cause progression of the tumor. So there are some benefits to exercise specifically to colon cancer. So now what can you do to start an exercise program? So the first thing is you want to make sure that you're cleared by your doctor that it's okay for you to start. And then you want to just pick an activity that you enjoy. If it's walking, cycling, gardening, taking a yoga class. You just want to start with something that you enjoy, something that you can start with, a few days a week, and then try to increase it to a little bit of an activity every day. You want to start at a low intensity, short duration, even if it's just like a 5-minute walk, 5-minute walk in the house, in your backyard. Work up to about a half an hour, maybe about 60 minutes of an activity. And again, starting at a low intensity and then increasing to moderate to a vigorous activity. So these are just suggestions of activities broken down into the level of intensity. So a light intensity activity, light walk or short walking, a short bike ride. When you're doing these activities, you should still be able to hold a conversation, walk with somebody, talk through the whole thing. You shouldn't feel like you'd be coming out of breath. And then you can start to progress to a moderate intensity activity. You should still be able to hold a conversation, but maybe singing a song where you're having to hold a note is going to be a little bit more challenging. But you can still, sing if you want to challenge yourself that way too. So progressing to maybe biking on hills, doing a little bit more of a brisk walk, and then progressing to a more vigorous activity where you're still able to talk, but maybe just saying a few words at a time. And you also want to be careful that you don't want to choose an activity where you feel like you have to stop, rest, catch your breath, where you don't feel like you're able to breathe, you're becoming short of breath. So there is a line as to what is vigorous, but get your heart rate going, but then what is too much. So strengthening is also an important part of exercise and combating cancer-related fatigue. You can progress the strengthening to 3 times a week. There is no, research doesn't show that there is a magic number, so there's no specific times that you should be exercising or strengthening. There's no specific amount of weight or repetitions. So through the research, these are just guidelines that they've given. So starting at a low intensity, 60 to 70% of your 1 rep max. So basically what that is if you want to start an exercise program, you want to start lifting weights, you go to pick up maybe a 5-pound weight and it feels, it's like a little bit of a struggle, you can do it a little bit, that would be your 1 rep max, to the point where you can kind of lift the exercise, but maybe just one time, but it's not straining. So then you take that weight and take a percentage of that. It's often dangerous to just experiment and try to find your 1 rep max. So oftentimes with my patients, I'll just do an estimated 1 rep. So we'll try something, I'll look to see their form, see how they're reacting, and if I just feel like, I don't want you to do the full rep, then we're just going to take a percentage of that. And in terms of the sets and repetitions, just start with, little sets, not too many repetitions. And again, there really is no magic number, so this is just guidelines as to what to start with. And then just slowly start increasing the weight, increasing the repetitions that you do. The American Cancer Society does have guidelines on how much activity that they recommend for adults. So adults should be engaging in at least 150 minutes of moderate intensity exercise to 75 minutes of vigorous exercise, and preferably spread out throughout the week. So the main thing is, when you want to start an exercise program, that you do check with your doctor to make sure that you're okay to start. Pick an activity that you enjoy doing, and then just start at a low intensity, light intensity where you still put up hold a conversation. Progress the intensity with strengthening, again, just starting at a light repetition where you're not straining yourself. Main thing is that with the exercises that you're not having any kind of pain. And if you need any further guidelines, you can always seek out a physical therapist to help you. So that's my presentation, short and sweet.